Health Networks. It is my very great pleasure to introduce the hustings for the 2025 CCIO Advisory Panel elections. Boy, do we have a fantastic lineup of candidates for you, not like real politics, hey? So let's take it from the top. First candidate to give her stump speech is Olaman Detun Aragon. I'm sorry if I've mangled that, and who's the Senior Nurse Advisor Application Systems Analyst for Guy's and St. Thomas's. Hi, are you ready?
Hi, John. This will be a video, which I'll share now.
Okay, that's great. Off to a flying start. Huh? As soon as you're ready now.
Hello, my name is Olamido Twanlayirogun. I'm an occupational health professional turned digital health enthusiast, and now I work as an application systems analyst. This nomination means a lot to me because it represents not just where I'm at, but where I'm going. My career has always been centered around people, whether it involves advocating for patient safety, ensuring the health of staff members are protected while at work, optimizing clinical systems, and ensuring that the digital tools used in patient care are used safely and efficiently. I have completed the Clinical Safety Officer Intermediate Training. I have also been involved in clinical digital transformation projects, and I've led on meaningful system changes. But more than that, I bring heart, curiosity, and real commitment to ensuring that digital health works for everyone. If elected as a member of the CCIO Advisory Panel, I'll bring fresh perspective, I'll champion inclusive change, and I'll work with passion and lead with heart and strategy. Thank you so much for listening to me, and let's help shape the future of digital health together.
Thank you. Okay, next up we have Zaid Al-Hilali, who's a pharmacist at Frimley. Zaid, are you there? Hello, Zaid, are you there?
Hi, John. Sorry, there was a question mark over if Zaid would attend or not, so I would.
Oh, I'm sorry, I missed that question mark. Right, let's move smoothly along to a current member of the CCIO Advisory Panel who's standing. We have a few of them standing, which is great. It's Leah Ali, who's a consultant psychiatrist and digital health strategy at South London Maudsley. Hi, Leah.
Hi, John. Thank you. So I'm Leah Ali. I'm a consultant psychiatrist and a clinical safety officer, and I worked in multiple different sectors in health and industry and in the front line and in the centre. I want to start with quoting an American president. It's all right, not that one. I mean Roosevelt, who said, "The credit belongs to the man or woman who is actually in the arena, whose face is marred by dust and sweat and blood, but who strives to do the deeds." This was a quote used by a colleague of mine, Chloe Stewart, when she nominated me for CCIO of the Year, and for which I was shortlisted to a finalist last year in 2024. It's my favourite ever bit of colleague feedback because it's about doing what's needed to get the job done, no matter what your title is and no matter what the hurdles might be, including being a woman of colour. I'm asking your vote as one doer in the arena to another, because I believe digital clinical leadership is vital to tackling these challenges. The rapid digitization of services, particularly in the AI era, brings major opportunities to improve health outcomes and system performance. But we all know too often these efforts are difficult to implement, risk safety, or worsen health inequalities. If re-elected, I will focus on 3 priorities where I have a proven track record. Connection. Silos threaten patient safety and block innovation. I've just been on a call where I have just seen how that operates when you're talking about millions of people. The panel should lead by fostering connection across professional, organisational and regional boundaries. I've prioritised this in my work, including leading the embedding of clinical safety and clinical governance by design in the NHS app, supporting service delivery to 37 million people in England. Creation. In the age of generative AI, creative sector methods will become essential. I have unusual cross-sector expertise in clinical design and founded the Needy Network to connect clinicians, designers, and other professionals in transdisciplinary dialogue. We've reached over 100 members in under a year. Care. Every digital interaction must meet a health need responsibly. I've developed the digital clinical services model, now informing aspects of national strategy, which treats digital channels with the same care as any other health service. It is human-centered and mindful of the communities we serve. Thank you for listening. If you believe in the importance of people in the arena to drive progress, then please consider supporting me.
Thanks, Leah. That's wonderful. Next up, can I call on Asad Ashraf, who's GP Clinical Director and Digital Transformation Lead at NHS North East London ICB. Asad.
Thanks, John. Hi, everyone. Yeah, so I'm Asad. I'm a portfolio GP. I wear many hats. I'm also a CCIO, so that list kind of goes on and on and on. I'm on different advisory panels. So I'm actually part of the GPC England, working at national level. And I also work in health tech and have done for about a decade, helping startups implement their tools within the NHS primary care sector. My main focus is on primary care and community care. That's where I've had over a decade of experience, specifically focusing on automation, interoperability, and improving patient access and the patient journey. I'm quite hands-on, so I've helped, like I said, I've helped a lot of these tech companies, without trying to name drop, navigate the clinical safety pathways that we find very difficult. I've also helped them navigate the digital framework within primary care. What I really want to do is the three-pronged attack. One is look at interoperability between primary care, secondary care, and community. It's a pet project of mine that I've been doing for the best part of 5 years, and I feel that we really need to kind of nail that one down. The other part that I really want to do is make it easy and faster and safer for new startups to be able to implement and develop their tools to help us in our current jobs. And then finally, I really want to help the next generation of clinical leaders. Being a clinical leader myself, I feel that this role will help open and navigate that. So that's me in a nutshell.
Brilliant, thanks, Asad. Moving swiftly along, it's Amit Bakai. Amit is Clinical Safety Officer and Chief Research Information Officer at the Royal Free. And Amit's also one of the existing advisory panel members standing again. Amit, are you there?
Thank you, John. Yeah, no, I'm here. So day job is a cardiologist, and today I'm at Digital Accelerator London meeting. My pitch is that I've been not only a CSO and a CRIO, but also a research director. And I have a huge interest, 20-year interest in research. And we've done really well with drugs and devices and diagnostics, but actually having a research framework to digital, having a research framework to intelligent automation and AI tools is really important for me. I've already been a year on the CCIO panel, helped with summer schools and Rewired conferences and many other groups, but mostly I'm known for my difficult but important questions to panels and leaders in the NHS, tactfully, but actually reminding them that the way to adopt things is actually safe and sound evidence-basing. But after that, once that evidence is done, is actually getting the uptake through commissioners, getting SMEs, getting small companies that have got really cool innovations that can go through for the NHS, but also have wider applications. So if you appoint me, I'll do three aspects. I will push for continued funding for innovations and helping with grants and so forth, bringing together industry, ABPI industry, the pharmaceutical industry as well into this game, because we can actually get funding from them, and publishing frameworks for safe evaluation. And lastly, enabling adoption for safe and sound digital technologies with the mentorship of 20 years of experience. Thank you, John, for the opportunity, and lovely to meet you all.
Thanks, Amit. And just to echo what I said at the top of the call, I mean, it is a fantastic array of experience that you all bring to this election. It's very impressive. Next up is Basil Bekdash, who's the CSO and digital lead at Sheffield's Children's Hospital. Basil, are you there?
Hello, good afternoon, everybody. Shall I just fire away then? So for those of you that don't know me from the circuit and from the networks, I think those that will have read my content and things that I've talked about will know where I'm coming from. But for the rest of the audience, I'll invite you to vote for me for two major reasons. The first is we need a change in the way we approach these problems. And I think the biggest example of that is the fact that we have one plan all the time, and that's all we ever adhere to. There are needs to break silos down. The questions I tend to ask are around the fundamentals and the bedrock of what everything is based on, and actually challenging a lot of the assumptions about existing ecosystems. I would say that we need parallel plans. It's something I've become very keen on promoting, that you have to have a plan for right now, you have to have a plan for the very long term. And I think that's something that needs to be higher up on the agenda, particularly with the single patient record discussions that are happening right now within the NHS as it moves to DHSC. The second big sort of thrust of what motivates me is where I work. I come from a paediatric background predominantly. I think it's an underrepresented group that needs a greater say in how things are designed, and actually has great lessons to teach the rest of health and care in terms of how things should be designed in a way that's more universal. So I tend to challenge exceptionalism. I tend to promote universality about the design of things, and I think that needs to be more embedded in how we do things. So if any of those two things chime with you, please consider voting. As a final plea, London's a fantastic place, but I'm actually based not as southern as I sound. I currently work in the north of England. I think it'd be good to sort of spread out the variety of where things are coming from. There are some great leaders from the past from the north of the country, and while we are still involved, I think reflect that in the voting that you go for, because while there is a lot of fantastic work in London, in the southeast, you have ready access, which a lot of the rest of us in the rest of the country don't have, to people who are making decisions. Thanks for your attention.
Thanks, Basil. I don't think you'll get any argument from Lauren, who, as well as being the manager of the networks, has a part-time job working for the Sheffield Tourist Board. No, she isn't, but she's a proud daughter of Sheffield. Okay, next up we have Jonathan Bevan, who's the digital medicines lead at the Mid Yorkshire Teaching Trust. Jonathan, are you there?
I am. Hi, John. Hi, everyone. I'm Jonathan Bevan, a pharmacist and digital medicines lead and clinical safety officer at the Mid Yorkshire NHS Trust. And I bring experience that speaks directly to the challenges we all face, from digital overload and variable literacy to the need for explainable AI and interoperable systems that actually support care. I've led multi-trust digital programs and chair the North East and Yorkshire Digital Medicines Network. I've set up a national AI collaborative for pharmacists, and all this is focused on sharing ideas that matter most to clinical teams and breaking down those silos. To quote Douglas Adams, at this point, we're all stuck with the technology when what we want is stuff that actually works. I consider digital literacy a core clinical skill, and as such have created a digital educator role in my trust and wish to advocate in the space. I'm also leading a co-designed AI project with staff and patients grounded in the safety and governance. So I know what it takes to innovate in the NHS, and I wish to see safe, smart data sharing across the NHS using IG frameworks that we can trust. If elected, I'll bring delivery experience, system thinking, and a commitment to digital transformation that strengthens clinical judgment, maintains clinical patient relationship, and improves care, not replaces it.
Brilliant. Thanks, Jonathan. Next up, I'd like to call on Angela Bergen. Angela is National Institute of Health Research, Clinical Doctoral Research Fellow and Advanced Clinical Pharmacist for Digital Medicines at the University of Bradford and leads teaching hospitals. Angela, over to you.
Thanks, John. So hello, I'm Angela, and I bring a unique combination of frontline experience, academic rigour, clinical informatics expertise. And I think for me, the real thing that gets me out of bed every day is this person-centredness in a digital NHS. So I've got over 20 years experience on the clinical frontline as a pharmacist, and I've spent more than half of that time using the tech in practice. I've spent 7 years in the clinical informatics space implementing technology, and that was followed by a clinical leadership fellow year where I learned systems thinking and transformation leadership, which has really transformed how I think about this work now. And I'm now currently near the end of my PhD in digital health, so lots of arms there. And I think what I've learned over that time is that really to realise the benefits of digital health, we really need to embed that research into every stage of the design, implementation, the evaluation and use of the tech. And I think for me, research and all the theory really helps us to answer those real world questions, and it turns those good intentions into evidence-informed decisions. So I believe that we really need to build a stronger bridge between practice, policy and research. And if elected, I'll champion that approach and I'll advocate for high quality practice-based research in a bid to really support staff with the delivery of safe, effective, person-centred care with technology. Thank you.
Thanks, Angela, and best of luck with completing the PhD. Keep you busy for a little bit. Next up, we have apologies from Bishoy Dimitri. Bishoy is the Director of Clinical Informatics at Oxford University Hospitals. He's one of the 3 vice chairs we currently have, but unfortunately can't join us. And moving on next, I think this one is another video. It's David Gaunt, who's the CCIO and Emergency Department Consultant at Buckinghamshire Hospitals NHS Trust. David, are you there on video?
Hi, I'm David. I'm sorry I wasn't able to be with you for the hustings today. I wanted to just give a quick message to say good luck to everybody and just tell you a little bit about what you might get if you were to vote for me and if I was successful in the voting. I'm very much a hands-on clinician working in an A&E department, and my focus really is on that human-computer interface, what people really want from IT, how digital can help us and can help our patients. This isn't about technology, this is about the people behind the technology and what we need to do to support everybody from patients, staff and the wider community. Thank you.
Thank you, David. Next up, I'd like to invite Sarah Hambridge, CCIO at Leeds Teaching Hospitals NHS Trust. Sarah, are you there?
I'm afraid Sarah is also someone who couldn't be here today.
Oh, okay. Sorry, I missed that. Apologies from Sarah Hambridge. Okay, moving on to next person is Geraint Jones, CCIO at Leeds Community Healthcare. At least we're sticking with Leeds.
Hello, I'm Geraint. I'm a physio by background, so this is my first opportunity for standing at for the advisory panel. I work in the community as the CCIO and clinical safety officer. I've got a history of working as an advanced practitioner in acute care as well, but given the general movement out into the community, I feel that it's really important that we have a strong community voice for digital in the future. I want to make sure that the voices of the community staff are not overlooked, and that our patients are included in the care that we want to give them via digital means. So for me, I'm thinking about inclusivity across both staff, patients and their carers. I want to make sure that we're evidence-based in what we're doing with digital change. So it's about the so what and the now what that is going to drive the actions that come forward. And it's not just about having nice, impressive dashboards that we all look at and smile and think that's great, but what we actually do with that information to make meaningful change. And as I said, it's meaningful change to make sure that what we're doing is developing tools that solve real problems and not just create ones. And I've seen firsthand how digital can actually increase the burden on our staff and on our patients and families. So it's trying to make sure that we're optimizing their experience as well. So I'd like to champion inclusive design that includes all users in all settings, advocate for solutions that work across boundaries, push for a digital transformation that's always improving care and not just about implementing technology.
Thanks, Geraint. And one of the striking things about the entries this year are quite a number of CCIO pharmacists, and that's been a massive kind of trend of recent years, one which has been championed by our next candidate, who is Ramandeep Kaur, who is the UHN Chief Clinical Information Officer, that's University Hospitals of Northamptonshire. She is also the current CCIO of the Year, as voted in 2024. Hi, Ramandeep, are you there?
I am. Good afternoon, John. Good afternoon, everybody. Thank you very much. So my hosting statement is going to be in poetic format, and it's entitled CCIO Elections. So CCIO with a passion for digital medicines and clinically led transformation. Currently the only pharmacist as an elected member of the CCIO AP formation. Integral to our digital and data team at the University Hospitals of Northamptonshire, on a mission to improve patient care and be a leader who inspires. Excited to move us all forward in digital and away from paper. Leadership, end user engagement, inclusivity, and focusing on digital confidence are all key strengths in my favour. Empowering a multidisciplinary approach through usable digital solutions, including AI and EPR, is my advocacy. Committed to serving this panel and bringing my knowledge as a CCIO and from pharmacy. Trailblazing as the only pharmacist to have won in 2024 the Digital Health Network CCIO Award. I'm passionate about lifting others as I climb upward. On the mentoring programme, Rewired and summer school committees and much more. Networking, learning from others and supporting the next generation of digital clinical leaders is at my core. So vote for me, vote for Ramandeep. Thank you.
Thanks, Ramandeep. Bit of poetry to proceedings. Can't complain about that at all. Next up is one of the three vice chairs of the network. It's Penny Kechagioglu, who is the CCIO and Deputy Chief Medical Officer and a consultant clinical oncologist at University Hospitals Coventry and Warwickshire. And in fact, we're bringing summer school to Penny's patch in July. Penny, are you there?
Delighted. Hi, John. Hi, everybody. Good to be here with you today. So, as John said, I'm an active clinician, and my experience spans from implementation, procurement to implementation to scaling up of technologies, of innovation. And importantly, my passion is around digital health and how do we use technology to enable patient care, improve patient outcomes, and make sure that patients have got self-management tools to be able to live in the community rather than coming into hospital unnecessarily. So how do I do this? Why am I passionate and why do I do this? I think this is all about partnerships and collaboration. And I work very closely with a large network of industry providers and SMEs. I run challenges with the local academic institutions and are trying to take ideas from frontline innovators from an idea to implementation and scale. And this is really important. This brings teams together, multidisciplinary teams, because digital is all about people. And it's about people bringing together to enable the adoption and spread of innovation. I also like to develop digital leaders, and I've been a mentor through the digital health networks for the past 2 years, and I have kept really good relationships with my cohort mentees who I have seen developing and being promoted during that time. So for me, the next steps is I really want to get further evolved into elevating the clinical voice, but also the patient voice, because we as clinicians should be elevating the end users, the patients, to have the right sit on the table and make change on health policy when it comes to digital. Thank you very much.
Thanks, Penny. Next up, we have Marina Khan. Marina is prescribing support pharmacist at Birmingham and Solihull ICB. Marina, are you there?
Yes. Hi there. Good afternoon, everyone. I'm Marina Khan, a pharmacist with multi-sector experience, now working in primary care across Birmingham and Solihull, supporting nearly 200 GP practices as an ICB pharmacist. So I believe digital transformation should be inclusive, practical, and shaped from the ground up. I work in one of the most deprived areas in the country, and I see daily how digital tools can be unintentionally excluding patients or sometimes the staff, especially the patients whose first language is not English. And that's why I've been advocating for multi-language access and interactive avatars in the NHS app to better reflect our patient needs. I want to bring the frontline insights into national strategy, identifying barriers early, supporting digital literacy, and creating practical solutions like establishing digital hubs in GP surgeries to help our staff and patients navigate these digital tools confidently. I've served as a reverse mentor to an NHS England executive, and I chair our organization's staff race equity network. So I'm no stranger to championing inclusive thinking at senior levels. So if elected, I'll be a strong voice for our primary care sector, equity, and real world innovation, ensuring that digital health works for everyone and not just the digitally confident. So I would love a seat at the table to bring a fresh and more diverse perspective to co-design a digital ecosystem where no one is left behind. Thank you.
Thanks, Marina. Well said. We next have up Ankit Khanna, who's consultant and deputy CCIO at Maidstone Tunbridge Wells NHS Trust. Wow, we're skipping up and down the country with these candidates. Ankit, are you there?
Yes. Hi, good afternoon, everyone. My name is Ankit. I'm one of the consultant pediatrician and deputy CCIO for women and children. Now, I want to highlight my case just by giving two very quick examples who are very close to my heart. One is that working in the digital capacity when I was working with the PCN networks in order to roll out the neighborhood programs for childhood obesity, I saw there is a significant gap in terms of representation from the children and young people. And that not only affected our data, it affected the products and the vision and the health policies which are being designed for next 5, 10, 15 years. And I feel I can bring a value to this committee from the pediatric background. I know one of my colleagues have mentioned the same, and I think we can have more than one from the north, one from the south, which will bring a holistic approach to the committee. The second I wanted to just highlight very quickly is that while working into the digital programs, I have realized that change management can be an incredibly difficult process in the multi-layered organization like NHS. One of my visions is to have triple E's, which is education, engagement, and equality. And therefore, if you believe in my vision, kindly give me a chance. Thank you very much.
Thank you. Next up, I'd like to call on Yvette Kozan, who's lead EPMA pharmacist at West London NHS Trust. Yvette, are you there?
Hi, thanks, John. I've delivered digital prescribing rollouts across acute mental health, community, and secure services where digital failure isn't just inconvenient, it creates clinical risk for the patients. I've led full dispensing rollouts in community pharmacy and previously ran a startup focused on digital tools for mental health. So I've worked across both NHS and entrepreneurial spaces. As an AI developer, I've built chatbots that give clinicians real-time answers from SOPs, tackling a key issue we face, which is fragmented guidance and growing digital burden. I'm currently on the NHS Digital Health Leadership Program, and my work spans implementation, governance, and training, but always with a focus on usability. If a system doesn't reduce cognitive load or clinical risk, it's just noise at that point. And what I'd bring to the panel is just a lived experience lens, translating national policy into usable workflows, pressure testing ideas in high risk settings, and ensuring innovation is safe, scalable, and improves the patient care. And that's the core of everything that I do. Strategy only works if it survives that frontline reality. Thank you.
Brilliant. Thanks very much indeed, Yvette. And again, I'd stress that there's a real breadth of experience that's standing for the advisory panels, very encouraging, and I think huge potential for learning from one another and sharing those experiences. Next up is someone who I've got marked as not been able to make it, but I thought I saw him pop up. Laurie Kidd, who's anaesthetist and clinical transformation and product lead at Gloucestershire Hospitals. Did I imagine that, or is Laurie actually with us?
I am here. Hello.
Laurie, hi.
Hi, afternoon, everyone. Yeah, I was thinking about this. I asked my daughter, who's 8 and quite sensible. She said, first of all, tell them what I do for a job. So I'm an anaesthetist in Gloucestershire. I also work for Doctor as clinical product lead, and I'm also CSO and do various bits of advisory work as well. She said that to tell everyone that I'm nice and a little bit funny, which I think I'll take. If an 8-year-old thinks your jokes are a little bit funny, then I'll take that. And then she said what you'd like to change. And actually, it just resonates with what everyone's been saying. I think it's amazing. I think there is a danger of having siloed perspectives and everyone kind of reading off the same hymn sheet. Marina, what you said about kind of inclusivity and the kind of diverse population, absolutely rings true. I think it's so true. I think it's important that people don't get left behind. And I'm just really keen that the voices that are shared are not just kind of preaching the same stuff, but actually being like actually inclusive and actually considering those who are digitally marginalised and kind of at the kind of peripheries of our society, be it digitally or more general health inequalities. And I'm not even a CCIO, but that apparently is an exclusion criteria. So yeah, I just thought I'd throw that in there and be honest about that. That's me.
Thanks, Ronnie. Glad you could join us, and hang on to that kind of that your daughter's finding you funny. That will fade, trust me.
I mean, I know it's a fleeting moment.
Next up, we have Matthew Laundy, who is CCIO at NHS South West London Integrated Care Board, my part of town. Matthew, are you there?
Yep, I'm here. Good afternoon. Apologies if I disappear. I'm in South Africa at the moment, and the power supply there is a little bit on the iffy side, but I hope I'll make my way through the minutes. So a quick thing, I'm the CCIO at South West London ICB. I've been there in the post for 3 years, maybe not that much longer. I've been 27 years in the NHS, and previously I was CCIO at St George's in London, which is a large teaching hospital. And I have been a member of the NHS Digital Academy and also an undergraduate degree in digital. So what is my goal? Well, my primary goal is around collaboration and connection across a few systems within the NHS. And this is pretty much what I've been doing in my role as CCIO of the ICB, is bringing people together. So what do I bring? Well, I mean, it's always said, but digital change is about people, not just technology. And what I bring to the team is the communication skills, but also very much about teamwork skills and bringing people together. So what I would say is vote for me to build a unified, digitally empowered NHS that puts the patient first. And thank you very much.
Thanks, Matthew. Yeah, flaky power. That was an issue yesterday around these parts. Next up, I'd like to call on Yat Lee, who's CCIO, Clinical Safety Officer and Consultant Anaesthetist at Royal Wolverhampton Hospitals. Hi there, Yat. Or is this one that's marked that they... Oh, no, sir. Unfortunately, they can't join us. So moving swiftly along, we have Jane Lim, I hope, who's CCIO, Codicot Guardian and Consultant Physician at the Royal Free.
Hello,
Hi,
yes,
Jane.
I'll step in for Ms. Lee. Yes, I'm Jane Lim, and I'm just really impressed how many CCIOs are in the first half of the alphabet, so sliding down with an L there. So I think really the question is, how can we as digital clinicians set the agenda, and how can we deliver change? I think that's really important because we're right in the middle of large-scale transformation that is in the way we work. That's what society wants from healthcare, and that's new technology. So I think the world has thrown the gauntlet down for CCIOs at this point. So I think the mission a lot for CCIOs over the next sort of 5 years is, how do we get around from what everybody's just said, the massive chasm across the country and globally of digital maturity? How do we navigate things like interoperability, convergence? How do we recognise also with the digital maturity gap the health inequalities we have nationally, and how do we level up through data? And how do we use our existing systems to deliver population health and advanced clinical research? So, and how do we set that trajectory in that period, 3 to 5 to 10, towards safe delivery of what's really coming next? So that's new technologies, that's AI, that's cloud-based EPRs, that's the supply chain of mass digital production. So background about me, so I've been a CCIO since about 2021, delivered EPR, HIMSS-5, GD-FOS follower, have been a single site CCIO and done about 60, 70 transformation projects over the years. Was also on the NHS Digital Academy with several in the room, trained as a health economist, and been a digital director in the private sector, developing products for children with chronic diseases. And I think also what's really important is I work in ED every week, and I live what it means when a system does not and does work for us and for the patient. And I think it's really important every day, every week, to have that anchoring and clarity of voice that you need at a national body to understand what it means to integrate clinical that clinical frontline with things like community research, innovation, and focusing it really crucially on delivering for the patient. So I think the Digital Health CCIO Advisory Panel has a real core role in shaping what we all feel we need to do in the next 3 to 5. Thank you.
Thank you, Jane. Next up, I'd like to call on Andrew McHale, who's Director of Pharmacy and CCIO at Practice Plus Group. Andrew.
Thanks, John, and good afternoon, everyone. I am Andrew McHale. I'm the National CCIO and Director of Pharmacy at PPG with over 15-year clinical leadership experience. It is a great privilege to be nominated, and I would love to join the CCIO AP. Mainly, I want to keep digital transformation grounded in clinical reality and what actually works on the front line. Now, you will notice there is a lot of talk about digital ambition, but I bring the lived experience of delivering it across system level. I worked on the front line. I influenced executive boards to listen and follow clinical leadership. I contributed to national policies, included national launches of health IT systems in Scotland and Wales, which is they do it differently than us here in England. So there is a lot of parallels and different experience when you launch a national unified system. I have scoped and submitted business cases. I walked the floor during go lives and overseen the safe rollout of systems, deploying various technologies, AI, triage. We looked at deployed clinical coding using AI, AVTs, complex and interoperable APRs with EPMAs and specialist clinical solution. I'm the CSO of my organization as well, and I make sure that health technologies are safe and usable and genuinely add value. The main point is they shouldn't lose sight of the people who rely on them. If I elected, I'll bring a practical voice to national conversations, and I will champion safe innovation, well-governed, and I will support future leaders across all clinical backgrounds, especially those who are underrepresented. Thank you.
Thanks, Andrew. Next up, I think, is a candidate that has sent her apologies. It's Lena New, who's consultant colorectal surgeon at Northumbria NHS FT. Lena, are you unexpectedly there? No, okay. Like the other candidates, in fact, all of the candidates, biographies and mini manifestos are on Discourse. I encourage you to go and have a look. They're really very good indeed. Next up is the current chair of the CCIO network. It's Dermot O'Riordan. Dermot, over to you.
Hi, thank you, John. Thank you, everybody. And some great existing members of the advisory panel and perspective. And as I think Leah put in the chat, we might need 26 people. My name is Dermot O'Riordan. I have been a CCIO for 11 years. Previously to that, I was medical director, and I was also interim chief executive of my organization. I'm now currently on my second career EPR procurement implementation with a go live. So I put in Cerner in West Suffolk, successfully got global digital exemplar status, which is quite an achievement for a relatively small organisation. And now in the neighbouring organisation for Ipswich and Colchester, putting in Epic. So I've got a pretty good experience of two of the vendors with a large footprint. I've been a long-standing and active contributor to the digital health networks, not necessarily frightened to challenge orthodoxy or even sometimes behaviours which need to be challenged occasionally. And I think I have the credibility at a national level to know a little bit about what I'm talking about and advocate for the profile of the networks, and whilst fostering and encouraging others, because you can't do things on your own. I'm a big believer in the user experience, but also the use of data to improve care, track record of getting things done in terms of we did the first cross-vendor health information exchange with Epic in Addenbrooke's. We did that. I put in and then from there, little old West Suffolk has actually been the hub for sort of the regional shared care record scheme, which still slightly I still find slightly bizarre how little old West Suffolk has done that, but also put in our patient portal back in 2016. So absolute believer in giving patients access to their data to help improve care. So it's been a privilege to do what I've done so far, and if elected, would carry on trying to raise the profile and trying to keep the role of CCIOs of all multidisciplinary, raise that and raise the panel profile and try and get things done in what is going to be challenging times. But things like the single patient record, being involved in those sorts of conversations with other organisations like the HL7 and PRSB as well, to try and make certain we have the best things for patients and for our staff. And thank you very much.
Thank you, Dermot. And maybe just is the point worth kind of mentioning to candidates that once the election results are in and we have the elected new advisory panel, then those 12 individuals will be asked to elect from amongst themselves a chair and vice chairs for the advisory panel. So, so the networks elect the advisory panels, and then the advisory panel members elect the chair and the vice chairs. And I think, as I mentioned earlier on, we actually ended up with 3 vice chairs, which was a new development for the CCIO network in this current kind of cycle. And they've all been very kind of effective. Right, so next up, I think we have a video. We've got 2 videos coming up, and what I'm going to suggest in that is that we do the video from Reena Patel, first of all, who's Senior Healthcare Strategy Consultant and Principal Pharmacist at Leeds Health and Care Partnership, West Leeds Primary Care Network. And then we'll go to the second video immediately afterwards. So Nat, if you could roll videotape, that'd be great.
Hi, I'm really sorry I couldn't be there today. I'm Reena Patel and I'm a pharmacist by background, and I'm standing for the Digital Health Network CCIO Advisory Panel because I believe we need more diverse, grounded and system-connected voices shaping the future of digital healthcare. I've worked across primary care, commissioning and digital transformation, not just from a strategic level, but with a real understanding of frontline pressures and opportunities. I'm not a CCIO by title, but I collaborate closely with digital clinical leaders, health tech innovators and NHS teams to help make digital change meaningful and inclusive. I find that too often digital transformation is done to people and not with them, and I really want to be able to champion the voices of those delivering care and those who aren't often heard, ensuring that digital innovation really is going to support patients, staff and system goals alike. As a woman in digital health leadership, I also feel strongly about ensuring we reflect the diversity of our workforce and the communities that we serve at the decision-making table. So if elected, I really hope that I'll bring energy, honesty and a real strong commitment to practical, people-centred innovation. Thank you for considering your vote.
Thanks, Reena. Almost bang on 60 seconds there. I don't know why someone referred to videotape, showing my age. We're going to go to the next video we have, which is from Yilan Tan, Senior Occupational Therapist at Imperial College. Are we ready with the video then, Nat?
Hi, I'm Yilan. I'm an occupational therapist, but also a self-taught coder and digital co-founder of 2 technology products back home in Singapore. With my entrepreneurial background and NHS experience, it's easy to see where my passion for health technology comes from. I've created my own gamified neurorehabilitation web app, and that's earned me the Turnstile Award for Innovation in 2024. I'm also a proud Curie Network Fellow, and I truly believe in the value of digital inclusion and diverse leadership in health technology. As a younger clinician, I often feel quite intimidated in spaces where senior or managerial voices shape digital strategies. This is why I'm stepping up, and if elected, I hope to be able to ensure younger clinicians get the support, mentorship, and opportunities in order to shape the future of digital health. Thank you.
Thank you. We have apologies from Prasanna Surya Kumaran, Professor of Neurology at University College Hospital and University of Oxford. And I've been asked to kind of read a short kind of statement from Josh Terry, who also sends their apologies, Assistant Director of Pharmacy, Digital Transformation Innovation at Royal Wolverhampton. And statement or his pitch is where I think I stand amongst the group. Like most, I have a track record of leading digital teams, developing policy and strategies, and developing workforce, managing trustworthy clinical systems, and all the things you'd expect from someone in my role. Like some, I'm an NHS Digital Academy Healthcare Leadership Program alumni. I'm also alumni of Chief Pharmaceutical Officers Leadership Program. My USP is around harnessing my learned experiences that I've developed over the course of my career so far. I'll be representing the workforce with real-life broadened experience. The Band 2 pharmacy assistant in me will be there, the Band 3, 4, 5, and 6, and so on, up until the role that I sit in today. Will be pushing to empower change for our colleagues and the NHS to deliver the best care possible to patients. And second, I want to get underneath the surface and find ways to create action. I'm not interested in talking about doing, and I'm not incentivized by any personal portfolio-based benefits of being part of the panel. Okay, I think that's everyone. Lauren, do tell me if I've missed anyone or failed to give anyone a mention.
Yes, if you just scroll down, there's another person.
Is that Alia Turk?
Yes, I believe she is here.
Okay, Alia, are you on the call?
I am, yes. Can you not see me?
Oh, I'm sorry, I can't. Let me just introduce you properly. Alia Turk, who's the Chief Pharmaceutical Officer Fellow for UK HSA. Alia, over to you.
Hello, I'm Alia Turk. I'm the current Chief Pharmaceutical Officer's Clinical Fellow, and I'm excited to stand for the Chief Clinical Information Officer's Advisory Panel role. A little bit about me is that I've worked across various electronic systems in my over 15 years of experience, leading on digital health transformation and implementing a governance system for high-cost drugs, and with a focus which is always on reducing health inequalities and equity access of medications across regions, regardless of the geographical boundaries. In my experience, I have spanned across the full NHS landscape. I've worked in tertiary centres, mental health, community, primary care, commissioning, and currently I'm embedded at the UK Health Security Agency, where I have championed both equity in healthcare delivery and digital design, including looking at digital and data designs to help with pandemic preparedness and responding to outbreaks. I come from a remote and rural areas, and I've also worked in urban regions. This gives me first-hand insight into the most unique challenges and nuances of developing meaning digital reach. I've also been a formulary pharmacist in two regions, which was predominantly delivered by an electronic interface. I've improved medication access through these electronic systems, and I've also successfully launched mobile phone apps to further help a digital reach. I am a dynamic and I represent the workforce who are most likely to use and depend on these digital systems daily. My work is practical, is people focused, and it's grounded in real world experience. This gives me a deep understanding of both frontline care alongside the national digital strategy. I am passionate about digital equity and committed to inclusive practice. Through the Midlands network, which is another network which I'm also a part of, I believe that a diverse panel helps us better serve the needs of our diverse populations. And it's important that we ensure that digital future is equitable and representative of all communities. If elected, I will bring strategic vision and hands-on experience to ensure the digital systems work for everyone. And I'm just going to finish on saying that an equitable digital health sector is where products, platforms, and services meet the needs of everyone, in particularly those underserved communities, which is what I'm most passionate about. Thank you for your time.
Thank you, Alia. Lauren, is that now everyone? Is there anyone that I've missed out?
That is now everyone. Thank you very much, everyone.
Thanks, everyone, indeed. I'm afraid we're not got any time for any questions because it wouldn't be fair to just give a few people a chance to answer. So what I'll do instead is recap. We have an extremely diverse set of candidates standing for the 12 elected places for the CCIO Advisory Panel, standing for a 2-year term. We are asking members of digital health networks, that's all 7,500 members of the networks, to cast their vote for the CCIO, CIO, and CIO advisory panels. These are the only directly elected leadership communities of NHS, IT, and digital leaders in the UK. And I know democracy's had a bit of a bad time of late, but I think it's important that these are voted for by your peers. You do have an opportunity of representing your peers, colleagues, and the profession. And sometimes even there is a strong interest from the centre in hearing what the advisory panels have to say. And I think lots of opportunity for spreading best practice, collaboration, and helping inform the centre during a period of very significant change. Voting is open until Friday. I encourage everyone to go to Discourse to read the manifestos for all the candidates where the voting instructions are. Lauren, I'm sure there's going to be a final mailer or two before the end of the week with a last call to vote. Is that correct?
Yes, there will. That'll get sent out later this week.
You know, I don't have favourites amongst the networks, but the CCIOs are the foundations. You were the first, you were the ones that kind of got this whole movement going. And it is, from a personal stance, very, very pleasing to see the networks in such rude health with such a array of talent standing for election. So I wish you all every luck in the elections. The voters can be fickle, so don't be too upset if they, for some reason, kind of set aside your obvious talents. We definitely would like to involve as many of you as possible in the advisory panels, even if you should not be elected on this occasion. On behalf of Digital Health Networks, I thank you all for standing and wish you all the very best of luck. Thanks, everyone.
Thank you.